we put together a core intervention package, and those are highly effective and cost-effective. These are tobacco control policies, such as high excise taxation, fiscal or regulatory action to reduce salt in manufactured food products, bans on trans fatty acids, again, in processed foods to the extent feasible. And then we also advocate for opportunistic screening in high-risk populations for diabetes and in adults coming to primary care centers for hypertension. We further, in those scenarios, when we've screened a patient, we advocate for use of combination or generic therapy to treat these conditions. And we also highlight the need for use of aspirin, beta blockers, ACE inhibitors, and statins. So this is a cocktail of drugs that can be applied across many conditions, many cardiovascular conditions. And we say that these should be made available to treat patients with heart disease, heart failure, and peripheral vascular disease, kidney disease as applicable. We found that that self-management education for diabetes is highly cost-effective, and also screening for the long-term complications of diabetes, particularly with, for example, consistent foot care or screening for albumin leak in the urine to screen for kidney disease, are also effective and cost-effective interventions we found. In terms of caring for kidney disease, the data were very limited, but we felt that treatment of patients who have kidney disease and hypertension with use of a particular class of medications would be very, very helpful. And in areas where, like in middle-income countries like Brazil or India or South Africa that have a well-developed kidney transplant program, adding in deceased donor programs would be cost-effective. In terms of respiratory disease, we focused mostly on obstructive lung disease and asthma, and really recommended that first-level hospitals develop algorithms to care for patients with acute exacerbations of these conditions, sort of in the vein that that algorithms have been developed to manage acute heart attacks, and that some basic medications like low-dose inhaled corticosteroids and bronchodilators be made available for patients with these diseases at the primary health center.